Okay, hi everyone. My name is Sonia Israel, and I am the Director of Scientific Partnerships at aifred Health. And we're trying to increase treatment efficacy in mental health using deep learning. So, major depression is a serious mental illness that will affect about 11% of individuals globally over the course of their lives. And in terms of disability burden, it's currently only second to cardiovascular disease and is predicted by the World Health Organization to be the leading source of disability by the year 2030. So what's alarming is that these rates are growing over time, and the cost associated with depression in the US is about $210 billion per year, and that's about $32 billion per year in Canada. So what's the source of this problem? Well, in this area of psychiatry, there's actually not so much a problem with diagnostics as much as there is with treatment and recovery. So there's dozens of medications, different psychotherapies, different neuromodulation treatments, and they all work to varying degrees, which is okay, but the thing is that these don't all work the same for everybody, and that's because people are different. We have different genetics, different symptom profiles, and the same treatment can have wildly varying responses in different individuals. So what ends up happening is that doctors and their patients end up going through a lot of guess and check, where they'll try a treatment, wait to see for it to take effect or not, and then go from there. But what this leads to is that many patients often have to spend years and years trying different medications or other treatments before finding something that works for them. So this is problematic because it leads to a lot of increased suffering for patients, it increases the healthcare costs, and it further clogs the mental health, the system in order to wait, the time it takes to wait the time it takes to see a mental health professional. So it's the inability to accurately predict the individual heterogeneous response to treatment. That is the problem. And so we want to know how we can address this problem quantitatively. How can we usher in the age of personalized medicine, precision medicine to mental health treatment? If we could somehow generate a systematic, evidence-based tool to improve the ability to predict treatment efficacy, we can increase people's qualities of lives, alleviate the socioeconomic burden of depression, and allow healthcare professionals to be able to treat more patients. And that's exactly what we're trying to do. So at aifred Health, we are using deep learning to build a comprehensive, evidence-based decision aid to give healthcare professionals the ability to assist in rapidly selecting the most effective treatment for any given patient as early on in their clinical course as possible in order to minimize side effects and to reduce time to symptom remission. And so it's important to know that this solution does not by any means aim to replace or supplant clinicians, but rather to give them a tool to augment their decision-making abilities by making available this evidence-based tool for personalized medicine for depression. So how are we doing this? Well, our priority is to identify predictive parameters in the categories listed at the bottom here. And these are both relevant and clinically accessible in terms of minimized cost and invasiveness. And so our research team is conducting a series of systematic reviews to assess the hundreds of potential predictors in these categories. And the purpose of reviewing this scientific literature is to provide domain knowledge to our machine learning team to help with feature restriction, that is, to choosing the set of predictors which will ultimately be most relevant in terms of predicting outcomes. So we've built in-house a modular framework called VULCAN. It incorporates a combination of cutting-edge technology, of deep belief networks, self-normalizing architecture, and snapshot learning, amongst other things. And we made it modular, so this allows it to be easily adapted to different data sets. And the data sets that we're using are clinical trials and study data in order to ensure high-quality throughput. And so here's one example of its modularity, adapted for multi-objective learning. We've also validated VULCAN on Fashion MNIST, which is a data set for benchmarking algorithms. And I'm pleased to announce that VULCAN has been performing extremely well. And so there's 3 core features of VULCAN. That is dataset characterization. So that allows us to use different visualization and clustering techniques in order to see if we have enough data and whether or not our data is somewhat linearly separable. VULCAN also has very high network optimization, which allows us to rapidly prototype new networks without sacrificing any customizability. And the final and most critical component of VULCAN is its network interpretability. So we cannot treat aifred, the aifred solution, as a black box, or else no physician is going to trust it. That's why we're focusing on both technical and clinical interpretability, using techniques like saliency maps and receptive field analysis in order to really precisely identify the parameters that had the most weight in suggesting a treatment. So our grand challenge is really to eliminate this trial and error approach in mental health care. And we want to save the system's time, save patients' time, save the system money, and help doctors provide more effective treatment to more people in need. So we're currently working with research lab data sets. We have our deep learning model, like I mentioned. We have a back-end infrastructure deployed on the IBM cloud and performing well. We also have our wireframing for our front-end interface completed. And so we're currently in late-stage talks with the pharmaceutical companies for clinical trial data, as well as other research initiatives. And we're in mid-stage talks with a university in Wales for access to national health database data, which is really exciting. And we're preparing our clinical phase trials for implementation. We're also about to enter our first round of fundraising. So the support we're looking for is access to more data sets, as always, financial support, and we're always looking for domain experts in health tech, as well as in artificial intelligence. So that's it.
Voilà. Bravo. Thank you. Merci beaucoup, Sonia.